Let me ask you, in the case where Dan's not even thinking surgery, this is literally a cortisone injection for shoulder bursitis. Just again, I want to emphasize, of course, any procedure has risks, but this is not some massive operation. This is a very simple procedure in someone's trained hands. You're not even thinking that that's a possibility. So what do you do when you end up in Dan's shoes and months later or a month later, you get this phantom $1,400 facility fee from a hospital when you're just in a clinic office?
You say as a patient, look, doctor, I don't mean to be impolite in asking this question, but what should I expect to be billed for this service? And if the doctors are not honest and straight with the amount of money, then when you get that bill, you let the person on the other end know that a place that does not show prices has no right to garnish your wages or send you to collections or ruin your credit history.
If you make that phone call, and again, I bet in a lot of these circumstances, I'm not even sure the provider knows these bills are showing up, because to me, having seen how these billing practices work, you can get a hospital facility fee charge and none of the providers may even know that's happening. So let's say you're gonna make the call and you call up the facility, the hospital, and you say, look, I have a problem with my bill. What is the quickest way to either get it downcharged or potentially, to me, make it go away if it's basically a spurious facility charge?
Well, the very first thing you ask when you call to fight or negotiate your bills is, before we get started, do you have the power to fix or reduce my bill if there's a mistake on it? If the answer is no, if you're just talking to a call center representative, you need to go over their head and go to the next person. And you keep going and you talk to the finance department, you talk to the executives, you leave a message at the executive offices, and engage your doctor. Doctors can help.
Dr. Makary, I mean, you've said it before. Number one, it starts with understanding your health care plan. Do they pay for operating rooms, outpatient surgical facilities, physician's assistants, surgical assistants, pathology, any other tests afterwards? You need to know that up front. And as you always say, don't be afraid to ask if those things are part of my treatment and am I responsible for it?
Ask and document, so when those collectors call, you say, look, I'm happy to pay this bill if you can show me where I agreed to this amount of money. Because these hospitals many times have very sloppy procedures and you're kind of being thrown without any, customer service of any quality. And you tell those collections agencies, show me a contract that I agreed to this amount and then I will pay it.
And these facility fees have been around for a while, but in 2009, facility fees were as low as $25. But now they're over $1,000. Is there anybody regulating this? Or do we just have different facilities saying, you know what, I'm gonna charge $800. And then this facility says, you know what, I'm gonna charge $1,000. Like, is there any regulation, or can facilities just charge what they want?
They can charge what they want. It is so bad. The price gouging in medicine today, not everywhere, but some places, it is so bad that it is a disgrace to our profession, and it's an embarrassment, and it now is starting to violate the public trust. We have people at home sick and scared, afraid to go to their doctors for fear of the bills. Go to the private sector free websites like mdsave.com. Look up your procedure on fairhealth.org. And go to these platforms now that are providing honest prices for medical services that are clear and transparent.
We'll have a link to some of those on our website.